Okay, so I have my YouTube account. This is going well. Just shared YouTube. My name is Kevin, but it has both our names on it. My last name and the other person's first name. I'm using it for medical topics only because my other account has storm chasing and all this kind of stuff, which is my name. Kevin is the first name. So it is my account, but I have longer videos for the pain. This is just a short introduction. We're pushing, there's a healthcare crisis, first of all, and it's the worst thing I've ever imagined. Getting medications transferred and waiting days for life-saving medication when you go to a nursing facility or a hospital. Short staffing, people that don't want the job because of mandates for COVID still, and the vaccines, and isolation. I'm on 12 days isolation for COVID. It didn't even make me sick. You gotta wear gowns and stuff to come in there to make them hot and have to dress in gowns and stuff. The pandemic has been declared over, state emergency declared over. And I understand you want to keep infection out of the facility, but having patients alone for hours and isolated, not showered for 20 days, left to look like this, covered in infection, that doesn't help either. Or nurses and CNAs, nurses assistants, don't want to come in because it takes 5 minutes to suit up with stuff that really doesn't protect them. Wear a mask, So the pandemic and the emergency is over, but I've put on 10 days of isolation when everybody else is recommended for 5. It went through my nursing home recently, and I'm not sick from that. I'm sick from a sinus infection that went in my lungs after the fact, and I couldn't get enough people to suit up and come into the room and go down to the nurse's station and get an antibiotic for me, bringing it up anywhere from 20 to 75 times a day. 13 days of treatment with antibiotics. That's what I got sick from. COVID spread throughout the facility despite isolation. 98% of everybody didn't even get moderate symptoms. I only got my Paxlovid because I have an underlying condition. And only for 2 days, and overdosed on it, and then they dropped it. So there's a huge healthcare crisis between mandates and short staffing. People that quit because they don't want to be forced to get boosters. People that quit because they saw people die during COVID. It's bad. It's bad. People that don't want to deal with the short staffing now. New hires that are lazy. They got used to not working. There's all kinds of stuff. And the few good workers there have been here 8-10 years, and now they're dealing with the stresses of short staffing. But there's an issue of pushing the... Sorry, I have to inhale some of this for breathing. I'm not supposed to be talking. The fentanyl crisis and homeless and all this. 2 years of pushing this and nothing has gotten better. It's gotten worse. And it's left doctors scared to give out controlled substances. And it's left dying, critically ill, patients suffering in agony, unable to get IV medication or sometimes not even low-dose pain medication because the doctors are afraid of being prosecuted. And I heard it's going to affect cancer patients eventually. I don't even have an answer. I'm dying from inflammation. No one will discuss the real cause because it's too controversial. Watch my longer video, the 20-minute video, but I can't even get one reporter to listen to it. Not on the left, not on the right, not on CNN or Fox or anywhere else, local or nationwide. And people at home that have nothing to do with them, those jobs. Look up the hashtags on True Social, on Twitter, on Facebook, wherever. People aren't talking about it. We've dropped the ball. Even people who know or have been through this have dropped the ball. We've all got to work better on it. And no matter where you come from or what you believe in, somebody has to do something different and start paying attention. Sorry Biden, sorry Trump, sorry LGBTQ and your pride, racism, fentanyl crisis. There's some real problems in those areas and with some of those people. Whatever. It's across the board. Everybody's got some serious problems and has lost focus. But I'm telling you, pain and death, you suffer in the flesh. The tears are from the flesh. And the pain is in the flesh, and they don't give a crap whether you're gay, straight, bi, black, white, left, right, up, down, doctors, politicians. And if it's you or your family member, you're gonna know. So everybody get off your frickin' butts and start listening and paying attention. There's people suffering and dying. It's going to visit you and your family. I'm telling you, it will. And the way we're doing things now, you're not helping addiction and you're not helping the patients. But if you're going to push solving these other crises, there's another crisis, and it's the patients have got to be heard too. The numbers of us dying may be greater than those from addiction, or the same. And I've been against narcotic pain meds my whole life because I hate the rush, I hate the side effects. Now, I say, give me whatever you got. And I'm screaming for death because they won't give me barely anything. And we're ignoring these patients dying this way. And in my case, living too long this way. Having to live like this, if you're dead, you're lucky. That's the way I'm starting to see it. So watch my longer video if you want detail, but somebody take the story and run with it. Doctors listen, lawmakers listen, reporters listen, politicians, everybody, people at home after working your shift at Starbucks listen, or if you're unemployed, I don't care what you are. Start talking about it again. Get it to go viral. Use this massive amount of fast information for us instead of against us. Sending it quickly. Our technology. Hopefully, people will, and it's got to be a team effort meeting everybody. We have so much technology and knowledge in the world, let alone this country, to be allowing this to happen.